Okay, so we are so excited to ask you all of these questions because as two avid social media scrollers, I think Jordan and I fall into comparison sometimes on the
All
internet.
the time, yeah.
And so the first question that we all wanted to ask you was, what's the one thing that people get done that we see online that we don't know about? Or what are the possibilities even?
There are so many possibilities. And I would say that we're living in an era where minimally invasive procedures have become almost omnipresent. And so I think tiny little tweakments like Botox and fillers have become so commonplace that it's not just celebrities or influencers, but your friends and neighbors, your teachers, the people that you live right next door to, the people you're dating. Everybody is doing stuff like that, whether they cop to it or they don't.
So, like, what would be some examples of them besides the lip fillers and the Botox? Like, the things that we see a lot of celebrities, we're like, how does your face look like that? And, like, how do they all look the same? There has to be something.
Can it be invasive?
Yeah.
Okay, I think like an invasive answer.
Yeah.
Okay, so the invasive answers like the celebrity secret procedures.
Yes.
Okay, you guys know about Botox and fillers. Sorry, that was an entry level answer. Okay, the more sophisticated answer for the real mean girl answer for you guys is there are some lesser known procedures like submental liposuction, and what that is a procedure where we make a tiny 3 millimeter incision hidden in the submental crease right under the chin, and we use a stainless steel surgical straw called a cannula to suction out fat all along the mandibular border and define the angle of the mandible and the cervicomental angle to create a really beautiful swan-like elongated neck.
Oh.
And so when you see celebrities and various beautiful people around town, you see that they have these nice, perfect, long necks with no double chin, really defined jawlines, really beautiful angles, and submental liposuction often comes into play. And doing it at a little bit of an earlier age when you think, while you still have enough skin elasticity to get a nice, tight skin envelope, that is like a secret procedure.
What's the recovery time on that?
It's actually not very long because it's the surgery itself is under an hour and you can recover pretty well in a couple of days.
I want that.
Another similar procedure is buccal fat pad excision, where that's used to give a little bit of a slim sculpted mid-cheek sulcus, so it kind of gives you like a Zoolander face or like a model-esque feeling where you get a highlight in the cheekbone and a low light in the mid-cheek sulcus. So we make a little incision hidden in the inside of the cheek so no one ever sees it, and take out a walnut-sized amount of fat in here. And it just gives you a little bit of this sculpty feeling like you're making a kissy face or sucking through a straw, and it gives a little elegant feeling to the face. And then I would say like my number 3 would be a temporal brow lift, which gives a little bit of an elevation to the lateral third of the eyebrow. So a little bit of this subtle arch and femininity to the brow. And that incision is very tiny and it's hidden in the hair, so you don't see it at all.
Oh, wow.
Is there a downside to any of that?
Do you have a 3-for-1 special?
Wait, a question first. Are you able to give us examples of any celebrities who have this so people can visualize what you're saying? And if you don't feel comfortable sharing names, that's fine too. I'm just trying to think about, I can think of a lot.
Yeah, anyone who you're thinking of has probably done it.
Okay.
But I can't really talk about
That's okay.
anybody because maybe I took care of them, and I don't want to be inappropriate.
True. I want all 3.
Good for you for perhaps taking care of them.
Yes.
So if you look at pretty much anybody, can you be like, okay, like being a trained professional, will you be like, I know what they had?
Yeah.
Yeah.
I always want to be like, okay, tell us.
Yeah, right. I know. No, that's fascinating.